Hello friends, welcome back to Complete Medical Coding. Today let's discuss a few anatomy questions, okay, which have been asked in the CPC examination in the last 1 or 2 years, okay. So let's discuss those questions today. These are some important and common questions, okay, from the examination. I had taken it from the examination. So let's discuss it today. And please friends, if you are new to the channel, please subscribe. Please share my videos among your friends. So let's move directly to the video, the questions. First question. A patient sustains severe blunt trauma to the left upper abdomen and requires surgery. Which one of the following organs is most likely to be involved? Option A, gallbladder. Option B, pancreas. Option C, spleen. And option D, appendix. So here the patient is having trauma to the left upper abdomen. So in that case, and it requires surgery. Okay, so in that case, upper abdomen. So which organ is affected? That's what the question is. So upper part of the abdomen, which will be the upper part of the abdomen among these four. So answer is option C, spleen. Okay, spleen will be affected because it comes in the upper part, upper abdominal area. Now second question. Which of the following terms describes the motion of bending the forearm towards the body? So motion of bending the forearm towards the body. Option A, abduction. Option B, eversion. Option C, flexion. And option D, pronation. So which medical term or which term describes the motion of the forearm bending towards the body? Answer here is option C, flexion. Okay. Third question. Respiratory disease that causes overexpansion and destruction of the alveoli is known as option A, emphysema. Option B, respiratory distress syndrome. Option C, pneumoconiosis. And option D, cystic fibrosis. So it's a respiratory disease that causes overexpansion. It's the expansion of the alveoli in the lungs. So what is it called? That is called emphysema. Okay, answer is option A, emphysema. Now fourth question. Which of the following cavities are separated by the diaphragm? Which of the following cavities? Yeah. Option A, abdominal and pelvic. Option B, cranial and spinal. Option C, dorsal and ventral. And option D, thoracic and abdominal. So which is separated by diaphragm? Which part or which of these cavities are separated by diaphragm? The diaphragm is separated by thoracic and abdominal cavity. Okay. Diaphragm separates the thoracic and abdominal. So answer here is option D, thoracic and abdominal cavities. Okay. Fifth question. Calcium, potassium and sodium are classified as which of the following? Option A, estrogens. Option B, electrolytes. Option C, androgens. And option D, catecholamines. Calcium, sodium, potassium. It's an easy question, right? These all are electrolytes. So answer is option B, electrolytes. Okay. Sixth question. Where is Marfan tumor found? Option A, back of the eye. Option B, bone. Option C, ovary. And option D, salivary gland. Marfan tumor. It is found in the salivary gland. Answer is option D, salivary gland. Okay. Seventh question. What is thrombophlebitis? Thrombophlebitis. Option A, constriction, narrowing of valve. Option B, swelling of extremities. Option C, inflammation of heart valves. And option D, inflammation of veins associated with formation of blood clot. What does it mean, thrombophlebitis? Answer is option D, inflammation of veins associated with formation of blood clot. So thrombophlebitis, itis means inflammation, as you already know the medical terminology. Itis means inflammation. Okay, so thrombophlebitis means inflammation of veins associated with formation of blood clot. Now moving to the 8th question. When a patient is having ARDS, which system is affected? So in such type of question, first you should be knowing this type of abbreviations, because in examination you will be getting abbreviations also without the expansion. So you should be knowing this. Okay. So what is ARDS? That you should be knowing first. What are the options? So if you know the acronym, if you know that full form abbreviation, then from the abbreviation itself you will get the answer. Okay. So option A, respiratory. Option B, genitourinary. Option C, cardiovascular. And option D, nervous. So what do you mean by ARDS? What is the expansion? What is full form of ARDS? ARDS means acute respiratory distress syndrome. Those who are from medical background will be knowing this. Those who are not, they might not be knowing. So ARDS means acute respiratory distress syndrome. So from the word itself, you will be understanding that this is something which is related to the respiratory system. So hence answer here is option A, respiratory. Okay. 9th question. The outermost layer of the skin is called as. This is easy but important also. This will be useful for when you start your career as a medical coder also. Okay. So option A, hypodermis. Option B, epidermis. Option C, subcutaneous tissue. And option D, fascia. So outermost layer of the skin is called as. Option B is the answer, epidermis. Outermost layer of the skin is epidermis. Then comes the dermis. Then comes the subcutaneous tissue. Then comes the muscle. Okay, the order is like that. I had already taken anatomy regarding the integumentary system. You can check, those who are new to my channel, please, you can check my old videos. Chapter wise I had taken. So in that, all the layers of the skin, everything is mentioned. Okay, you can learn it from there. So outermost layer of the skin is called as epidermis. 10th question. Where is mediastinum located? Option A, both the lungs and heart. Option B, a part of lymphatic system. Option C, a location in the chest bounded by the sternum, diaphragm and lung. And option D, a small endocrine organ behind the heart. So where is this mediastinum located? What do you mean by mediastinum, or where is it located? Answer is option C. It's a location in the chest bounded by the sternum, diaphragm and lungs. Okay. Chest bounded by sternum, diaphragm and lungs. So answer is option C. Yes friends, that's it for today. These are few important anatomy questions. I'll come back again soon with more anatomy questions and more CPC questions. I was little busy these days, so that is the reason I couldn't make videos. So I'm planning to do at least 2 to 3 videos in a week. So let me try for that. Anyway, those who are supporting me, thank you so much for all your support. And those who are new to the channel, please subscribe. Please share my videos among your friends. Thank you so much and stay tuned. And we will see you in the next episode. I'll come back in the next episode with, let me see if I can do either CPC questions or else mock questions. So stay tuned. Okay. Thank you so much and take care. Bye.